Now on to private healthcare provision, which sits, of course, alongside the NHS, mainly paid for through health insurance, and in particular, company insurance being offered as a benefit is the main grouping of healthcare, paid private healthcare beneficiaries. So the numbers, to start with the numbers we're talking about, there are over 12 million people in the United Kingdom are covered for private health care. The provision is actually broader range than you'd think, which provides services for the NHS, not as much as only those you'd expect, but such as psychiatric care, long-term residential care for people with learning disabilities. Perhaps these things don't always spring to mind. One of the claims is that they help reduce waiting times because of the dilemma the NHS has between reducing waiting times, which would be elected operations and surgery, and the quick processing of people through A&E. The argument is that the excess that private healthcare would provide would help with that elected surgery, and so reduce waiting times. The benefits, the evidence can be said either way. So others can have argued more negative points towards them, and some have pointed out that they look in the private sector to look at high-end, high-revenue treatments. A visit for-profit hospital, for-profit hospital, and you're likely to see gleaming cardiac wing, top-notch brain surgeons and fancy CT scanners. What you are less likely to see are family planning services, emergency rooms, and psychiatric care. These services have a low rate of return of investment. Also, they've been accused of manipulating the figures and patient dumping. A study found that for-profits were twice as likely to dump emergency room patients onto the facilities of other not-for-profit patients who do not have insurance, or those whose plans do not cover emergency care, were more likely to be transferred. So there is some negative sides as well there.